2016, Duke University launched a new interdisciplinary initiative to advance health policy. This effort became a reality because of the generous support of Duke alumnus Robert Margolis and his wife Lisa, who founded the Duke-Margolis Center for Health Policy.
The Duke-Margolis Center has been transformational to Duke. Our goal is to improve health outcomes and health equity across the nation.
The Duke-Margolis Center for Health Policy is an interdisciplinary research and education program, university-wide at Duke, intended to help improve health, healthcare, and health equity for people locally, around the country, and around the world through better evidence-based approaches to designing and implementing healthcare policies.
One of the great strengths of being at a university like Duke is that we have access to extraordinary leaders, leaders in our academic enterprise, in our health system, and importantly, in the Duke-Margolis Center.
This has been an extraordinary partnership on so many levels.
Health policy is about influencing what people care about most when it comes to their health and the health of their loved ones. It's helping them get access to the latest and best technologies for their needs. It's helping them do so in a way that's convenient and accessible, and it's helping them do so in a way that's affordable and sustainable.
At the end of the day, it's a very personal problem. I think that there's so much more that we can do to make the cycle of biomedical production and approvals and payment more efficient, more diverse, and more meaningful to the patients that it needs to serve.
But we're really limited a lot of times by the data that are available. And that means that oftentimes policymaking isn't evidence-based. And that has been a place where the Margolis Center has focused and where we need to do more work to be able to understand, what is happening for these really important populations, huge percentages of Americans.
So as a mom and a nurse and a foster parent in our community here, I've seen how health policy can both affect and improve the lives of these vulnerable populations.
The work at Duke-Margolis is aimed at the broader world. It's aimed at having an actual impact on health policy, the way people get their health care, and what we can do to help them improve their health.
We have demonstrated that we can be exemplars in convening policymakers and providers and industry leaders and other thought leaders in coming together to tackle critical issues in health and in healthcare in order to come up with the right and most impactful policy decisions.
The Duke-Margolis Center first is a support for interdisciplinary scholarship to help us think deeply about health policy. It's a way that we can have direct engagement with policymakers and steer the course of healthcare in this country.
I think what's really unique about the Margolis Center is that it spans the whole university, and it really provides an avenue for interdisciplinary collaboration to address all of the most pressing issues in health and health policy.
I am a health economist, and I work on applied empirical research related to the healthcare system. The Margolis Center can help me make my research more relevant to policy and also provide a vehicle to convey the results of that research to policymakers.
What will stick with me would be the need to approach any solution in healthcare or otherwise from a very multidisciplinary lens.
I think one important aspect of the Margolis Center is that it's educating the next generation of leaders in health policy. And so the students who flock to Margolis to get these experiences, they're going to be the people who are setting the agenda in the future.
So our first scholar was Madhu Valmiri, who was a Master's of Public Policy student, and she, I think, is a great success story to point to.
I'm really proud to have been the first Duke-Margolis scholar and grateful for the opportunities that it's afforded me, the exposure that I got to a vast array of important health policy topics, the doors it opened for me in terms of getting to really meet incredible leaders in health policy across the state and across the country, and for how it really helped me find my purpose in choosing public service as the way that I wanted to make an impact in health policy.
I would say there's also an explosion of controversy in health policy now, and it's important to have trusted institutions that can not only develop high quality, rigorous, and transparent research, but can also communicate the results of that research to policymakers, consumers, the general public. So I think the role of the Margolis Center as a trusted institution is probably even more important today than it's ever been.
This is really an exciting time in health policy. There's a lot of problems within health and healthcare and health equity that need solutions and need policy solutions, and it's been really inspiring to see the interest of students and to try to meet that need.
In the future, I will be doing a job that has not been created yet. Duke-Margolis has done a really great job of preparing us scholars for that type of innovation and for that type of fast-moving environment.
Duke-Margolis has already established itself as a go-to entity for us as a university, for anyone thinking about the transformation in healthcare in the coming years. Our goal over the next 5 to 10 years is to build on this base of expertise, build on this base of reputation, and be the leaders who can help us think deeply about how our healthcare system can be the best in the world, how we can improve equitable outcomes for everyone in our country and indeed throughout the world.
We have more momentum and more collaborators than ever and more opportunities than ever to build on these successes and achieve a much healthier, a much more innovative, and a much more affordable healthcare system for the future.
Be assured, the best is yet to come.
Let's go Duke!